When the grant started, they figured out a way by using QR codes, we could actually put a QR code someplace in the room, and then the iPad would show what that piece of equipment that we were looking at, or the IV, or the wound on the patient's leg would really look like. So it was a way to bring the environment in without having to, install bunches of equipment and try to overlay devices onto different pieces of things with the patient. So how do we use the augmented reality in the ARISE project? Well, we really have a lot of patient-centered videos. This is really important to us. We feel like if our students know what the patient looks like and can kind of see the patient before they start, when they walk into that room, they already have a visual image, a picture. They know what the patient sounds like. They know the attitudes of the patients. They know like the different cues that that patient's giving prior to starting it. And it allows them to kind of already have that before they walk in, which makes the simulation a lot more real for them. We like the idea of using a lot of pictures to simulate certain things. So wounds is one. You can moulage all you want, but even with the best moulage, it just doesn't always come out the way you want it to look. And so by being able to use QR codes, we can take an actual open source image, they can scan that code, and the wound is really real. It looks very real when you scan it, you can actually measure it, and then you can interchange those and take those in and out depending on the scenario. We think it's really important, and one of the things we were really excited that we added was accurate heart and lung sounds. And we actually have it by location now. So you'll see that as we go through and play the scenarios later on today that, our mannequins, you have to hit a certain spot in a certain way, and even then the lungs aren't always that great, and even the heart tones aren't always that great. We were able to incorporate QR codes with sounds, so when they scan that area, you actually get actual breath sounds that change throughout the scenarios depending on the state you're at and the interventions that you've done. So we can actually change them at different times throughout the scenario. We have incorporated communication with other healthcare team members as well as family members into the scenarios. So rather than say, oh, a doctor showed up and did this, we can actually incorporate that video. Or family members, when they show up, we can actually have an actual video of a family member, which helps for continuity between groups as well, so that the different actors are playing the role a little differently every time. Every student sees the same video of that patient all the way throughout, which is really nice. We do have dynamic chart forms. So they have the iPad actually acts as simulated patient charts like you would see like in the hospital or any other environment. And with that said, as the states change, the orders actually show up on the iPad. So when they actually call the doctor and the state change in the iPad, the orders then are inputted and they can see them. Labs show up, x-rays happen. The chart is very dynamic throughout the scenario as you progress from state to state. And lastly, we do have some other few things that we've done within the iPads. As we move forward, we get way more creative, probably too creative, as Sarah would say. One of the things we did for the EMT paramedics is we have hotspots now. So they like to use this in the classroom as a lab type activity, and they're able to do hotspots for lung sounds. We can do that type of thing. We're incorporating a few other things in the scenarios as well. So we, as creative as Sarah lets us be.
So this is all based on learning theories. Eric Bauman, I don't know if you're familiar with him, he's out of Madison, does a lot of gaming and simulation that way. Feels that gaming are tools to provide structured spaces that simulate authentic practice. And so we'll show you in a little bit what we've developed as serious games. So it's not necessarily a funny ha-ha type of game, but it is a way that they can practice on their own independently. You could assign it as prep work, you could use it in a classroom, but it is more of a gaming type situation. We're all familiar with Patricia Benner, novice to expert. So Teresa will talk here in a little bit how we've leveled the scenarios. Level 1 really starts with novices. Level 4, they're going to be developing up to the expert level. So for nursing, our 4th semester students as they're in advanced practice, advanced clinical and transition. And then Kolb, really you hear Kolb cited a lot at the simulation conferences for anyone that's attended. The cycle of experiential learning. Has anybody heard of Kolb? So really that's what simulation is based on, that you're acting in the simulation lab or with our iPads. Then you have a chance to reflect on what you've done, how you've thought through it, and that's why debriefing is so important, because at that point, at the end of debriefing, you should have an abstract concept of how, heart failure looks and what goes on with heart failure, what are the symptoms, what do I do about it? And then the whole goal is to have active experimentation so that when you're in clinical or you're out in practice, you can use what you learned during simulation. So we built our conceptual model on these learning theories. like Teresa was explaining the storylines, and she'll talk more about this here in a second, underlies these different things you'll be able to do on the iPad. The serious games, like I said, are designed for more independent kind of work with students as they prepare for simulation. The clinical case studies, I'm going to skip over for a second because those have been the hardest for us to truly define. But simulation is just like you would normally do in a simulation lab. But we have divided it into high fidelity simulation and low fidelity simulation. So high fidelity, you know, you're making it as real as possible. So we have Jerry, right? This is Jerry.
I think it's Jerry.
So he's one of the lower fidelity simulators, and then you have we have Stan, where Stan responds like a normal adult would respond to anything happening. So we have that going on, and then today we'll also be sharing how you can use a low type fidelity of simulation in the classroom using something as simple as this, where this is the patient and you put it in. That's where we're thinking this might be more of the clinical case study piece, where you put this in the table with a small group of students, and this is your simulator, and with the QR codes, they'll be able to still see the patient videos and listen to the heart sounds and listen to the lung sounds. So the NLN asked a few years ago that we try to debrief across the curriculum and in the classroom, and we really think that this low fidelity simulation is a way to do that.